Hey, you guys, welcome back for another week of Work It Out Wednesday. This week we've been covering everything on thyroidism. We have done hypothyroidism, hyperthyroidism, the treatments, quick tips on those drug interactions and contraindications. So, on Wednesdays, it's our Work It Out Wednesday. So, we work out practice questions to get us prepared for boards. Okay. So, here's the first question. I have a couple for you today. Number one says, Miss Anderson presents to the office today with complaints of weight gain, fatigue, and tiredness. Her TSH is 10, T3 is 75, and free T4 is 0.7 nanograms per deciliter. What is the best treatment option? Is it A, PTU, B, propranolol daily, C, Synthroid, 25 micrograms PO daily, or D, radioactive iodine? I will give you a second to see what you think. Let me know in the comments. All right, you guys, I always tell y'all, read the stem of the question first. Even when you feel like you know the answer right off the bat, this just allows that you slow down, helps you not to make careless mistakes, helps you not to rush through. And it also helps when you're anxious and, we create our own scenarios based off of what we may think they're asking us, but it allows you to slow down and answer what they're truly asking. So here the stem states, what is the best treatment option? Now, in order to treat, we got to know something that has been diagnosed, right? So here, based on the presentation, they have weight gain, fatigue, tiredness. The TSH is 10, and that is elevated, right? So it's elevated. Normal TSH levels are 0.4 to 4. Some may say 0.5 to 5. Lab values fluctuate. Based on the facility, exams are not going to try to trip you up, so it'll be a range below or exceeding that gap, so that but definitely 0.4 is on that low scale. So I like to tell you from that standpoint. But we can see clearly the TSH 10 is elevated here. T3 is 75, and if you're not familiar, it is low. Normal T3 is around 80 to 220. And then the free T4 is also low at 0.7. Normal is about 0.9 to 2.3. Now, don't be like, okay, Brittany, I don't know these labs. Oh my God, and get overwhelmed on me, okay? Start writing these down. Just like I tell you with farm, don't make it something additional. As you're learning, as you're studying, as you're reviewing for boards, write it down. So if you're doing thyroid, make a list of these things and begin to study it, and review it. And you'll begin to get a little bit second nature on it. But don't get yourself flustered and make this an additional thing to study, okay? So again, the TSH is elevated, the T3 and T4 are low. So you should be thinking hypothyroidism, because those T3 and T4 is letting us know that our thyroid hormone levels are low. So hypothyroidism, and the TSH is elevated, and that's what we look at as far as knowing how to treat. So your answer for this should be C, Synthroid, 25 micrograms PO daily. Now, the TSH level is what you want to watch and monitor as far as when to initiate therapy, as well as how to adjust your dosing, okay? So in 6 to 8 weeks, you need to have them back to monitor to see how that dose is working for the patient. Adjust as needed, or you may be able to stay there if it is working well. Seeing it how high it is, you're probably gonna have to adjust it, but you do it patient per patient. Now, after you get them in a correct dosage range, you can start to evaluate that TSH every 4 months. And once it's consistently in that correct dosage range, you can start putting them on an annual cycle to review. Okay. All right, you guys. Also remember, I'll just throw this in here too, but go check out the videos on hypothyroidism and hyperthyroidism, as well as the treatment. But I want to toss that into, with Synthroid, you want to make sure to tell them to take it on an empty stomach for absorption purposes. And also making them aware of the interactions for that drug, which are that calcium carbonate, the Lasix, and the food item, especially like the grapefruit, the papaya, and the soybean products. Okay. All right. Next question. Miss Mitchell is a 43-year-old female who presents with increased weight loss, brittle hair, and tachycardia. All right, the TSH is 0.2, T3 is 225 and the free T4 is 2.5 nanograms per deciliter. How should the nurse practitioner diagnose? Is it A, hypothyroidism, B, hyperthyroidism, C, thyroid toxicosis, or D, are these normal findings? I will give you a second and tell me what you got. All right, reading that stem of the question first, right? So how should the nurse practitioner diagnose? So again, if we're diagnosing, we need to go back, see the presentation, and see how they look to us to come up with this diagnosis, right? So the patient is 43, female. She's having weight loss. Her hair is brittle, and she has tachycardia. When looking at her thyroid panel, that TSH is 0.2. So that's low. You know, we just talked about 0.4 to 4 or that 0.5, I'll say 0.4 to 5. So you can know those ranges. So that's letting you know that's low. The T3, 225 is elevated, and the free T4, 2.5 nanograms per deciliter is also elevated. So if you have a low TSH and an elevated T3 and T4, how would you diagnose? Would it be A, hypothyroidism? Nope. Because if it was, the T3 and T4 would be low, right? B, hyperthyroidism. Yep, because the TSH is low and the T3 and T4 are elevated. Thyroid toxicosis, no, they are not toxic. And then D, no, you know, these are not normal findings. All right, you guys, again, if you need a little bit more clarity, go back to the other two videos from this week covering this. They are short and sweet to kind of cover the content and give you the need to knows briefly. And if you want me to cover anything else, let me know in the comments. I'm happy to do so. But as always, like, comment, subscribe, and share with a friend or colleague who you think may find this helpful as well. All right. Bye, y'all.